Right.
What should I talk about? Send it to somebody who wants to see this.
What's up, everybody? Going live here. Gonna adjust these cameras just to be a little bit more in line because I'm gonna get in a little bit closer. So, all right. So we're going live, and let's see. Is that a filter? That might be a filter.
Shouldn't be.
No. Okay.
I thought the same thing in the middle.
Yeah. All right, guys. So wait till you guys pop back in. Where's everybody? Hello from San Diego. What's up? Mizuniga. Hello, hello. Hi, Bella. How are you? Let's see. Who else is here? Where's everybody from? Who's the farthest person from? Oh, you can't hear me. Let's see. Check if all these connected. That's good. We got to do a sound check.
What platform is that?
Instagram.
That's right here. Testing. It says it's popping up here.
Yeah, I saw it pop up. I'll get it back up just in case. Maybe. Let me look on mine. 1 second.
Okay, what's up? Can you guys? Wow, Australia. Can't hear you. All right, I'm still working on the sound. Okay, let's see. It's
I
this
can hear you on Instagram.
mic 3. Is that Instagram here?
So we have TikTok, YouTube, Instagram.
Let's see. Oh, I can hear you. Okay.
Yeah, there we go.
Great. All right, Lithuania, London, Egypt. Okay, Kentucky. Yes, I'm from Virginia, by the way. And I'm smoking 3 packs every 2 weeks. Is that bad? If you have to ask that question, it probably is. Michigan, Providence, Rhode Island. What's up? How's Bud Cianci doing? Kansas. All right, cool. You guys can hear me. It sounds like Halifax, Canada, of course. And Indonesia. That's got to be pretty. That's got to be the farthest. Paris, Alaska, India, Texas. Love it. All right, guys. So we're going to get into the meat of this. Bali. Wow, that's far too. So I want to talk about celebrity plastic surgery. And we can kind of get into some of your questions. Bella from Mississippi. We can get into some of your questions about celebrity plastic surgery. I've definitely done some celebrities, and I can't talk about them unless they give me permission, which they normally don't. And so if you hear about me talking about a celebrity, like if you look at some of my TikToks, for those of you guys who don't know, my TikTok at Barrett Plastic Surgery, I do have a couple of, what I think people have had done. If I say something about somebody, what I think they've had done, then it definitely means that they're not my patient, because I can't legally and ethically talk about patients that I've done work on without their permission. That's their medical information. So I can't do that. Come to South Florida, sure. Okay, so first one I want to talk about is Cardi B. And Cardi B is in the news recently because people are suspecting that she had a facelift. And I'm looking at the photos, and it could be. It's really hard to tell. You can't see. When you're looking for a facelift, you want to kind of look for the incision here. You want to look behind the ear. You want to look for like a windswept face appearance. I don't necessarily see that quite so much, but there is some changes happening there, and I'm not quite sure what it is. We've got to wait to get some better photos. But now she's admitted to having some plastic surgery in the past. 2019, she got fillers in her nose, and she said it got messed up. She got effed up, is what she said. She got a list of people from the Jenners, and she went to go get her nose fixed. Okay, so I'm pretty sure I know who that is, because I know who the players are in this town that do a lot of these famous celebrities. If I'm talking about them, if it's not myself, and. So she said also in August I got surgery to remove 95% of my biopolymers. And this one's kind of crazy. I think Cardi B is cool because she actually admits to some of this stuff that she gets done, and which I respect, because it's okay to look good, and it's okay to be honest about how you look good, because otherwise you're creating false expectations for what people can possibly achieve. And I think that's misleading. And I think if you're in the public spotlight, I think you have, in my opinion, you think you have an ethical duty to just be honest with people about certain things, so you don't create some body image problems for some people. Not everybody, but for some, they may like, look, I can never be as beautiful, or I can maybe be beautiful as this person, but this person had $100,000 worth of plastic surgery done to get that certain look or that certain body. She's also so the other part about that is she got injections into her buttocks of biopolymers, and that's something that we never recommend. We don't do that as a plastic surgery society or any plastic surgery. And that's something that's done in like people's garages to make your butt look bigger, and it's extremely dangerous. It can kill you, you get infected, and God knows how much she's probably spent to kind of get some of that stuff removed. But it's a good thing it hasn't really affected her more than it already has. So the other one is SZA. This is another person that's on my nice list. She admitted to getting a BBL actually in her song, so which is pretty cool. I think that's great. She's kind of come out and talked about, and not so many direct terms, that she's so classic, that ass so fat, it looks so natural. It's not. So great. It's not. If it's not natural, that's fine, and you want to rock it. But it's still her own fat. Somebody just took it from here and probably put it here, right? Which is great. You know, it's like you put on makeup every day. If some people put on makeup every day to look good, some people go to the gym to look good. What's the difference of getting plastic surgery? You know. So that's my thought. Leah Michelle buccal fat pad removal. This is one that we don't actually know for sure, and buccal fat pad removal is not one of my favorite procedures. I recommend people not get it for the most part because it thins the face out. As you get older, you're going to like look hollow, and you're going to want that fat. So I don't recommend buccal fat pad removal. But that's it. Those are the top three I have now. Oh, and Alex Earl, she's kind of recently popular, and she has admitted to getting a breast augmentation, saline through the armpit. Not my approach. I see pictures of her. It looks pretty good. But the problems with going through the armpit is, one, you get loss of sensation to the nipple typically because that's where all the nerves come through. There's a noticeable scar there. It's a dirty, higher rate of capsule contracture. And then saline, I'm not a big fan of either because it's more rippling and it tends to be more of a baseball. It's not a form-fitting implant, and it's kind of like a water balloon in your chest. And eventually they start to drop, and we got to do pocket repair and switch you out to silicone. So those are my thoughts on that. So BBL, yeah, I just did a BBL today. It'll be up on my Dr. Daniel Barrett Instagram. So if you guys on TikTok, check out my Instagram, Dr. Daniel Barrett, where I have a BBL that we're going to show you guys today or tomorrow. And I do it in a very natural way. It's Barrett BBL. So, okay, what else do we have? What are the questions? Can you talk about Liver King? Yeah, Liver King. So we had him in the office. It was actually serendipitous. I have been following him for quite some time. And I got into like eating raw liver and stuff like that in more ancestral ways. And I agreed with a lot of his stuff actually before I even heard about him. And his team called our office and was like, hey, can we come by and you prove or disprove whether or not he has ab implants? And this is when he just came out and people found out that he was on steroids, and he admitted to that. And so he wanted to like set the record straight in terms of his abdominal area, if he had any implants or not. So we brought him in. We did a couple tests that we figured out, and he didn't have abdominal implants, and he didn't even have abdominal etching. It was all natural, and you can tell that by palpation. Abdominal implants are really hard to do, and they're really hard to do to look right. I don't think anybody can really make them look natural. So I think he just had high muscle tone from a lot of the steroids and working out that he'd done, and his very low body fat. And he had no ability, no scars to be able to show that he had any kind of abdominal etching and so forth. All right, so let's get into a couple of the other questions. How do you achieve a natural rhinoplasty? Well, natural rhinoplasty is you have to kind of take the whole situation into consideration. Do you have an ethnic nose for, if you are, let's say you're African American, and we give you a Christy Brinkley nose, which is a Caucasian nose, right? That's not going to match up, right? It's going to look a little strange. So you want something to kind of match the bone structure and the ethnicity of a person, in my opinion. Now, if you want something that looks like a Michael Jackson nose, that's your choice. I typically won't do it because it looks very strange. And so it's important to kind of keep those things and know the techniques to achieve those results. We're really into preservation rhinoplasty right now. Preservation rhinoplasty is basically we're doing internal work so that like if you have a dorsum of the nose, it just comes down naturally without having to lift up the top portion here. So we can do it's kind of like a gopher going underneath your yard, and it kind of digs a hole, and then the earth kind of drops down. That's kind of what we do with preservation rhinoplasty, which is actually pretty cool. We're doing that. Okay, other question, any tips for preparing for a breast reduction? I'm getting one done in March. So breast reduction can be done for many reasons. A lot of times if you have, if you need a breast reduction, you have neck pain, back pain, and you have these straps in the shoulders, that can be very painful. The breast can be very heavy, and a lot of times insurance can cover this, which is great. You can check out my website, reductionsbybarrett.com, if you want to find out more information about breast reductions. But one of the ways to get ready for it is be at a goal weight, because I have some people that come and get a breast reduction, then they lose more weight, and then what we made as perfect breasts have now deflated, and we need to kind of tighten up the lift. So my number one recommendation for breast reduction is to get the weight loss first, and then do your breast reduction. The other thing is to optimize your health. So I have a website called Post-Op Recovery where I have a lot of the supplements that I've either created or handpicked to help you recover from any surgical procedure or prepare for a surgical procedure. So make sure you check out that website. My YouTube page, if you guys don't know about my YouTube page, is Dr. Barrett Plastic Surgery YouTube, and you can get a lot of the videos on what to expect, everything you need to know about liposuction, everything you need to know about breast reduction, everything you need to know about tummy tucks, right? I have videos on that. It's also on my podcast called the Natural Plastic Surgeon Podcast, but you might find the YouTube more engaging because you can see me talking about various things. Yes, surgery cover deviated septum surgery. Yes, Hannah, it does. If you have problems breathing, you have documentation of conservative efforts. So the other thing you want to make sure is you have good insurance. If you have Medicare and you have deviated septum, it's going to be hard to find a doctor who's going to want to do that. You want to make sure you have good insurance. Typically, out-of-network benefits, PPO, is what you want to do, because the doctors that are in-network are typically, depending on the state, may not be the best. Is it possible to get a reduction in implant to fill it out? Yes, Amanda Keeger, it is. It's something that's very complicated to do. Higher rate of infection. We do them quite often, but you have to be very careful. You want to take a small little implant, place it up a little high, and then reduce the bottom part of the breast so that you get more of a perky look. You're basically transposing volume to the top part of the breast and taking away from the bottom. If you don't take away from the bottom, then you get a kind of like a saggy breast appearance. So, all right, let's see. How can my natural deviated septum get fixed? It's hard to breathe out of one side of my nose. So my recommendation before you try to do surgery for your nose is to tape your mouth shut every night when you go to sleep. The reason why I say that is because your sinuses have the ability to open up and expand and close down. So if you tape your mouth shut every night, it forces you to breathe through your nose, and you'll probably open your airway passages without having to have surgery. I don't recommend corticosteroids. I've tried them. They cause a lot of nasal bleeding, and they're not really good to have long term. They can cause sinus infections and so forth. But that's my number one recommendation if you have problems breathing through your nose, is start taping your mouth shut every night and start breathing, forcing yourself to breathe through your nose, even on exercise. It's hard, but I did it. I can breathe a lot better through my nose. Now, if it's still not working, then you may want to consult with a doctor to look about getting your septum fixed. There's a book called Breathe by James Nestor. Of all the books I've ever read, it's in my top 3. Okay, so I recommend you get that book, especially if you have kids, even if you don't have kids, and read that book on how our noses and our jaws developed and how they didn't develop properly because of all the crap food and soft food we eat. Like the number one thing you can do for your kids to give them a square jawline, breastfeed, give them hard food to chew on, give them bones to chew on, give them hard things to chew on, okay? We got a little off topic there, but it's the truth. And read that book and you'll understand why. Is it too late to change that later in life? It is a little bit, but still you can make some progress, okay? What's the deal with face liposuction? Well, face liposuction is very challenging. I've seen it where people have done face liposuction and the face fat is integrated with nerves, so you have to be very careful. You have to use very small cannulas. It's a very risky thing. Most people don't do it, and you don't really want to get rid of fat in the face. You want volume in the face, so that's why it's typically not recommended. Now, occasionally in a little jowl area you can do a little bit, like I'll do neck liposuction and do a little jowl area, and then I'll do some Renuvion to tighten that. And that can work really well to kind of tighten the jawline, but you really don't want to do the whole face, because again, you want that fat as you get older. Let's see. What is your new CBD cream for? So the CBD is amazing. If you're looking for something to deal with chronic pain or anxiety, CBD is honestly, in my opinion, one of the breakthrough things that you can ever have. You can take the tincture, you can get it on my website, postoprecovery.com, or you can get it at a lot of other places. Mine's really good because it's all organic. I've had it independently tested, and it's really strong. It's 1,500 milligrams, and it has some terpenes in it that lower your inflammation in your body. Put a few drops underneath your tongue before your bed. You sleep better. Your deep sleep goes way up. If you track your sleep with an Oura ring, your deep sleep is going to go through the roof. And then you also lower your inflammation. It's great for pain control too. If you have chronic pain, like back pain, it can get rid of it, knee pain, stuff like that. And it also lowers your overall inflammation in your body. It's great after surgery. Now, what we just recently found out is that it can be administered topically. So I developed a high concentration topical cream. So like you could put it on your back if you're having back pain, your neck pain, any local area. You can put it on, lasts for about 6 hours. It's pretty awesome. And we use it for surgery. So people who have breast pain or tummy pain after a tummy tuck, put it on the area, it goes away. It's pretty incredible. All right, let's see. Can I get fat removed from my arms? Yes, fat can be removed from your arms, and the key is you want to be very careful. Make a very small incision. We used to do them here, now we do it here because it doesn't scar as much as here. We use small cannulas to kind of highlight the muscles in the area. Is 44 too old for a mommy makeover? No. I've done a mommy makeover on 60-year-old people, so 44 is quite young. What you want to look at is, are you go weight? Are you healthy? Are you fit? Are you smoking? You know, those kind of things. Any blood clots, history, that kind of stuff. That's what you want to look into, because the biggest risk of mommy makeover or tummy tuck surgery is blood clots. So you want to make sure you walk around right away. Here at my practice, we give everybody leg squeezers to go home with, and we give people anticoagulation for 1 week afterwards. And we encourage them to walk around at least 3 times a day. It's very important. Remember one thing, the bed puts you closer to the grave. So get out of the bed, move around, okay? The minute you're in bed for long periods of time is the minute you're going to start to decline and get closer to the grave. Let's see. When I want to get a mommy makeover, do I really lose all the weight and tone before? You don't have to. If you want to get a mommy makeover and you're kind of halfway through your journey, you can get it, but just know that you might have to get things tightened up. I had a lot of people that have so much extra skin, they don't even feel motivated to go to the gym. And they're like, I know I need to lose another 30 pounds, but I want to make a difference here. And so we do the surgery, get them on track, and then boom, they lose the extra 30 pounds. And if we need to, we can come back and we can tighten up the extra area. But if you can, it's recommended that you do that. My trap muscles. So what can I do to reduce my trap muscle? Someone asked. That's this muscle here. I have some transgender patients that need this done, and regular patients, and also some pain relieving people that want to get this reduced for pain. Is you can actually inject Botox. It's about 50 units of Botox in the traps, and it'll shrink it down. Lasts about 6 months. It's pretty cool. And I've lost 300 pounds and it shows in my face. Would you consider fillers or facelift? If you lost 300 pounds, you definitely need a facelift. You're going to need fat transfer and facelift. Don't bother with filler. Filler is so expensive, and you have to keep doing it. You want to do a one and done situation. It's kind of like, leasing versus buying a car. Buying a car that lasts you 20 years is a lot better than leasing a car for 20 years, right? That's how I look at facial fillers. When you can do fat transfer for majority of situations. A little bit of facial fillers here and there, no problem. But if you need a major overhaul after losing 300 pounds, which is awesome, by the way, I wish I knew how you did it, just go with facelift. Get a lot of the skin removed, get some volume where you need to, and get some resurfacing done all at one time. All right, so how can I schedule an appointment with you? So you guys, it's very easy to schedule an appointment. You can give us a call right now if you want to, 310-598-2648. 310-598-2648. Have people just say, hey, I want to schedule a consult with Dr. B, or I have a question on how much is this, or whatever, and we can get you plugged in. You can also submit online at my website, Dr. Daniel Barrett, at the virtual consultation page, where you can submit a request, submit some pictures, and we can get back to you about a quote, whatever else you want to know about. So I don't have a practice around Buffalo, New York, but I have patients that come from New York. I had a patient this week who was here from New York. It wasn't Buffalo, it was Manhattan, but I do have had people from Buffalo. Had a previous nurse that was from Buffalo. So Buffalo is a great place, but I don't practice there. I practice here. I am from Virginia. Thought about getting a license there, but I'm just so busy here. It's nice here. It's warm. Just come. It's Buffalo. It's February. Come to LA, get your surgery, hang out for a few weeks, and then go back to Buffalo, or hang out for a few days. Enjoy the weather. It's nice. It's like the cold. It was really cold this morning. It was like 48 degrees, and everybody was flipping out, and they're like, "Oh my God, it's so cold. The world's gonna fall apart." But like, if you go to a place that's really cold, like Alaska, someone who's from Alaska, where it's like negative 30 degrees, that's cold. All right, that's where you can like freak out and talk about how cold it is. But here in LA, it's really nice and warm and sunny, and it's a great place to visit, especially in the dead of winter. Okay, what are my thoughts versus lip flip versus lip filler? So filler is great for lips. Lip flip can do a little Botox here and it relaxes this muscle and sometimes everts the upper lip. It works sometimes it doesn't. Filler done right always works. So you can just do both. Will there be a noticeable difference between 400 cc's and 450 cc's? In my mind, yes. But most people not going to notice a difference in 50 cc's. So that's my opinion on that. Someone asked about my daughters. My daughters are doing great. They are almost 5, almost 3, and 1 year old. They're doing fantastic. This morning we had a dance session and breakfast before I came in to do some surgeries. So it was really nice. Okay, so we're going to answer just a couple more questions and then we're going to sign off. Does Botox chemicals hurt your body? KDN59, the answer is no. So, you know, of all the things you put in your body, Botox paralyzes muscles immediately upon injection, right? We know that. It's going to paralyze. Like I need for my Botox, you can see I got total forehead lines. So I would do Botox here and it would paralyze those muscles and it would relax the muscles that cause the wrinkles, right? So if you inject a lot of Botox in your body or it gets in your bloodstream, it can paralyze your diaphragm temporarily and you could die. But again, we're talking about like tens of thousands of units to do that. Normally that's with like consuming something that's been contaminated with botulism, like honey. So it's not a real thing. Like, and if you think about it, we kind of poison ourselves with some things on purpose quite often. So my opinion is like whatever doesn't kill you makes you stronger. And that's actually true. When you inject Botox, it stimulates more collagen in your skin. So you have more collagen growth after Botox injection, which we don't know why. It's independent of the muscle paralysis effect, okay? Umbilical hernia with mesh or no mesh. Crystal, that's a loaded question. You know, I typically would say try to do it with the tummy tuck, then you don't need mesh. But if you try to do it without mesh, without a tummy tuck, it probably is going to recur. Biggest way to improve your chances of umbilical hernia not coming back is to lose weight. How long is long enough to be safe to have a mommy makeover surgery after weight loss surgery? Tawana Phillips, I would just say when your weight's stable, it's safe to do it. And your labs are good. You got to check your labs and your B12. Can you make them look bigger with lifting weights? If you already have breast implants, can you make them look bigger with lifting weights? A little bit. I mean, if you build your pectoralis muscle, you can make them look a little bit bigger. So yeah, let's see. Do I still go to work on a bike? Yeah, I rode my bike this morning. I'm having trouble with the headlight, but yeah, I got it fixed. Can you use fillers for TMJ? Not fillers, but you can do Botox for TMJ. TMJ is an inflammation of the temporal mandibular joint, and you can inject Botox here into the masseter. TMJ is up here, but you inject it in the masseter here, and it relaxes the jaw muscles, okay? Libet, what's my opinion on breast implant illness? It exists. It's pretty rare, and when it happens because of contamination of the implant. So if you ever see my videos on how I put the implant in, I do about 14 different things to make sure that the implant goes in sterilely. When it goes in and gets contaminated, it can cause two things. It can cause most likely capsular contracture, which my capsular contracture rate is very low. It's like 1 in 200. Nationwide, it's 1 in 20. But it can also cause breast implant illness, meaning that you get a bacteria that forms on the implant, and that biofilm forms, and once that biofilm forms, your body can't clear that infection. So that's why it's very important to go to somebody who knows what they're doing when it comes to implants and has a very low capsular contracture rate. Because if they have a very low capsular contracture rate, chances are they're very low breast implant illness rate. There's also gut health that's correspondent to that. So that's why I have a whole gut health, probiotics, and gut support for my patients who are undergoing surgery so that it enhances your immune system. Two things, the digestive enzymes called Masszymes and the Biome Breakthrough by BioOptimizers. That totally changed and healed my gut. It's on my website, postoprecovery.com. The same price as you can get on Amazon. And it is fantastic to kind of heal your gut. I have a couple more questions, you guys. Thoughts on NMN supplements? Supposedly they work. They've done studies that show that NMN raises the NAD levels. If you want a real fix, then do an NAD drip if you have like an autoimmune condition going on, or if you have Lyme's disease. NAD drips have been proven to really improve that. And in my opinion, it's not studied yet, but UCLA is studying it. If you have long COVID, it will actually help improve your long COVID and COVID symptoms if you have COVID. So NAD NMN is a very popular thing. Do I do daddy makeovers? Yes. We do help with dad bod. We can combine it with liposuction of the chest and also male chest reduction if we need to. Thanks for letting me be safe on my bike, and recovery for breast dog, we do rapid recovery techniques. Most places about a week. We're about 4 days because of all the pre-injection techniques and the supplements that we start you guys on. So that's it for going live, you guys. Make sure you follow me on my Instagram, drdanielbarrett.com, so you can check out that BBL I did today. And follow me on YouTube as well. That's Dr. Barrett Plastic Surgery YouTube. Hit the subscribe button. You'll see all these full-length videos of much more detail that I can go into today. And of course, if you want to check out my TikTok, it's Barrett Plastic Surgery. We have all the fun stuff there. Thanks for watching.